You might have heard about rhythm SCENAR devices, which can relieve pain even when conventional treatments with medication, physiotherapy, acupuncture, and the like have failed. You might already have a rhythm SCENAR device, or you're thinking of purchasing one. Now, you need to know how to use such a tool for the maximum benefit of your patients. I'm Dr. Jörg Prinz. I'm a physician, I'm a SCENAR practitioner, I'm a SCENAR trainer. I run a pain relief and health recovery clinic in New Zealand. And I offer now online training courses on how to use rhythm SCENAR devices. When you purchase a SCENAR, you get a description of the different functions of the device and some suggestions for treating patients through the booklets that come with the device. But it is a little bit like buying a new camera. All the functions of the many buttons are explained in great detail, but even using just the automatic function on the camera does not guarantee a great, sharp, or even artistic photos. This is taught by professional photographers in, for instance, online training classes. And pretty much the same applies for SCENAR therapy. I offer 3 different training courses, level 1 through to 3, and they all build on each other. In level 1, I explain the different functions of the device from a medical perspective, rather than from a physicist's or engineer's perspective. I also teach the basic use of the device, working on the painful area, which we call the local zone, and on what is called the general zone. Although rhythm SCENAR devices are just approved for a large number of painful conditions, and the indications vary slightly from country to country, SCENAR practitioners regularly observe, apart from pain relief, additional beneficial effects on chronic health issues. To stimulate these effects, we not only work on the painful areas, but also on the general zones. I use animated PowerPoint slides to explain step by step how to work on a patient. In level 1, I focus on the more acute and milder chronic conditions your patients might present with. In level 2, I teach more methods to fine-tune your treatments. I teach additional treatment protocols that will help your patients more thoroughly, even if they have long-standing health and pain issues. In this course, I show you how to make decisions about treatment plans, how to help with detoxification, lymph drainage, how to balance the fine line of over or under treatment, and how to integrate SCENAR therapy not only into a conventional therapy as a then so-called complementary treatment, but also how to integrate SCENAR therapy into a total holistic health approach. Level 3 training deals with a fast approach of SCENAR application to specific health issues of mainly musculoskeletal system. Although fast is not always better, it is what clients and practitioners alike want these days. Dr. Boris Kulitsky from Rhythm OKB, the manufacturers of SCENAR devices, provides a lot of suggestions how to do a treatment in a shorter time while still observing basic SCENAR principles and to achieve great outcomes for the patients. We call this SCENAR physiotherapy. The protocols were developed in cooperation of Russian and German physicians and physiotherapists. This training also focuses on the new line of rhythm SCENAR devices, utilizing the many built-in presets Of course, you can use an older SCENAR device. I teach the appropriate settings for both types. All 3 courses are now run online. Therefore, it can be taught anywhere in the world. I teach in either English or German language. One course comprises of 3 sessions, all about 3 hours long. Each session is a week apart from the next to give participants enough time to practice the treatment protocols on either friends, family, or clients, and can give feedback at the next session. I will explain which settings to use, what protocols to apply in different situations, and I will explain everything in either medical or layman's terms, depending on the audience, so that medical and paramedical practitioners, as well as lay people, can get the full benefit of these courses. Each participant is also invited to provide case studies, which will be individually discussed. That helps the practitioners to learn from oversights, and I deliberately use this word rather than mistakes. There are no mistakes in SCENAR therapy. There is only effective or not so effective SCENAR therapy. If you want to be very effective, book your training course right now. I work with Rhythm SCENAR in Australia, Rhythm SCENAR World in UK, and with Rhythm SCENAR in Germany. You can book through these Rhythm distributors or directly at www.scenar.nz, or contact me through my practice website at www.drjoe.co.nz. I hope I see you soon on one of my training seminars.